Right. First of all, thank you to Ram Center and Angie for inviting me to give a talk today. I hope the audience will learn something. So the topic is working from home in the era of COVID-19, right? Tips to boost your mental health. So I also run the specialized sleep medicine clinic at Sengkang Hospital. In that sleep clinic, we see different types of sleep disorders like insomnia disorder, obstructive sleep apnea, and other forms of interesting sleep disorders. So I'll also be talking a bit about how to improve your sleep when you're working from home and when you're stressed because of the pandemic. Okay, feel free to type into the chat box or if there are any specific questions for myself and even Angie, we'll address them later on, right? So when we think about working from home, these are some of the images that may conjure up in our minds, right? We may be concentrating on the laptop, writing an essay for work with a croissant next to us, or like this Caucasian gentleman. I have difficulty finding Asian faces in the stock photos. You see, and also you may be something like this mom, right? Guiding your kids during home-based learning, right? So a lot of picture perfect, family friendly pictures of tranquility, peace, and concentration at work. However, the reality may be quite different. As most of you may already know, we may have to contend with non-stop emails or even text messaging, right? Nowadays, every office has a WhatsApp group with or without the boss inside, right? Right? And there's no alone time because your spouse may be at home, family members may be at home. If there are kids, when MOE kicks off the home-based learning is another big stressor for the parents, right? Who will have to struggle with childcare as well as kids at home. For those of us with elderly at home during the first circuit breaker, the nursing homes and a lot of the dementia daycare centers, senior activity centers, they are also closed down. Also, the caregiving duties will increase in the daytime, even as you are expected to work. Confining ourselves at home, there is no outdoors, no sunlight, physical activity levels will drop. For those of us who are living alone, it's another set of problems, right? Although there are less, say, caregiving duties, less distractions, but we will then tend to feel lonely, cooping ourselves at home like a prison within the four walls, solitary confinement. And then, the world has changed, right, with Zoom and WebEx and all the digital platforms where meetings and work is now conducted. There's no face-to-face interaction whatsoever. Everything is through a screen. So Zoom, Zoom, and Zoom again. So you can see there are a lot of articles actually documenting the mental health perils of working from home chronically. Singapore stress levels show working from home is no holiday. This respondent, Claire Ng, who was interviewed in this article, talked about how she used to knock off at 6 p.m. But now it feels like she's working anytime, all the time at home. There's no work end to the working hours. There's no start even, right? She could be sending emails at middle of the night. She could be taking a nap at 4 p.m., right? So it really is a different reality for us. Most of us probably work well on work from home, but some of us may find it difficult to cope. So there are other articles, local articles, right? CNA, putting in 50 hours while working from home is a struggle to draw a line between work and home. Right? Some of us may neglect our mental well-being, says IMH psychologist Miss Jeanette Lim. And being forced to work at home can create stress and fatigue for workers. Singaporeans are stressed out from being working from home and from the COVID-19 pandemic in general, such that 61% of those working from home are stressed out from work. And this is higher than the 53% of frontliners. Frontliners may include healthcare workers, right? Doctors and nurses, those of us in essential services. Right? Can you imagine that? It's quite surprising, right? I expect working from home to be less taxing, less draining. But the survey objectively shows that an even higher percentage of people working from home may be stressed out than even the pandemic frontliners. So I'm going to talk about briefly just 5 mental health tips, but I expand on each area in more detail. Okay, number 1 is setting the boundaries between work and home life, because working from home really blurs the boundary, right? And it blurs the boundaries in more than one ways, which I'll elaborate upon later. Secondly, managing relationships, all the more important because we are confined maybe 24/7 with our loved ones, and we may be missing out with our friends or our co-workers. Right? Caring for yourself, effective stress management. And the number four is about a more psychological, philosophical kind of a shift in mindset, cultivating gratitude, right? And finally, getting good sleep. So point number one, working from home, as I mentioned, blurs the boundaries between work and home in more than one ways. It blurs the boundaries temporally. There is no longer like working hours, 9 to 5, you know. In the past, even when we work overtime, maybe at 9 p.m. when I finally finish my work and I knock off, even though it's late at night, I can finally go to Kofu to get my supper, get my dinner, go home. Even though it's late and I'm tired, at least I can switch off and I can work. But right now, it's like I can always access my emails and answer my, there may be meetings scheduled after office hours because everyone is working from home. So that is a new norm. And I'm always multitasking, right? Preparing breakfast and preparing for the meeting at the same time. Okay, also blurs the boundaries geographically, because we are physically at home and we are working in our personal spaces. Could be the living room, the study, some of us the bedrooms, or working in the children's playroom, for example. So there is no longer a physical distinction between work areas and home areas. Psychologically as well, because then some of us may have work stress in last time, and when it ends, right? We get to enjoy the weekends. But now the boundaries are blurred temporally, geographically, and that's why in our minds, our brains may start to unconsciously associate our homes with work stress through a process called classical conditioning, where our minds will unconsciously associate things in our life between two areas, and that can result in work stress all around. Right? Okay, so tip number one, how do we demarcate the boundary between work and home better, preserve that boundary even while we work from home? So very simple practical tips, right? Temporarily, time-wise, we can follow a consistent schedule, be disciplined about our work hours, try to keep your devices, screens, and emails away after work hours if you can, right? Unless it's a mandate from the office by the boss, for example, or it's a scheduled meeting after hours. Otherwise, try to be disciplined about keeping your devices, screens, and emails away, especially during your bedtime, right? Because these modern features of our lives will never fail to disrupt our sleep and our rest time. Or there's never ends, right? Or we can always do more, right? Even though it's already after work hours officially. Okay, geographically, we can try to designate strictly for work areas and non-work areas. It's inevitable that some of these areas may mix up, right? But we can try to be disciplined about it, and it can help to reduce the psychological blurring between work stress or work routines and personal family time, personal and family rest time, for example. So we still want to preserve the structures and routines that we had even before working from home. These structures and routines, which I will talk about, will psychologically help us to transition between in the morning when we prepare for work and in the evenings when we end work, even though we are at home. So before work, we can try taking a walk outside or taking a bus to prepare for work. Even though we are working from home, we can try also changing to formal attire, something more formal, maybe a polo t-shirt, right? Or a smart casual kind of wear. If you're working in aircon, because the weather is really so hot these days, right? So having some routines built in, maybe a 15 to half an hour routine before work, can help us psychologically transition from our home personal rest time mindset to our work mindset. All of us will have different identities and roles, and for me at least, how I behave and think in work may be quite different from how I behave and think when I'm home or with my family, right? So I think it's like that for most of us. So we really want to get into the work place identity, the occupational role that we have, and leave behind the family role, for example, if we can, right, psychologically, before we start work in the morning. So after work, you can change back to your home outfit, or you can take a walk in the garden again. So taking a walk kind of simulates the journey, the commuting time to work. We no longer get to take the bus or MRT, but at least we can take a walk downstairs and also get some sunlight. That will help with our sleep as well, right? Okay, so we can demarcate the boundary between work from home in several different ways, right? Temporally, by hours, spatially and geographically by demarcating, designating work areas, and also psychologically, right? Okay, so we move on to the second tip. Probably, maybe the most challenging, right? It's managing relationships. Okay, so the work from home, when we spend almost the whole day with our family, even though we have to work, it really creates a strain for some family relationships. Of course, all of us may be in different circumstances, right? But on a national level, or in the year of 2020, the SOS local SOS agency, they had a 20% increase in crisis calls. And a lot of these calls, okay, this is in the year 2020 as compared to 2019. And you know that 2020 was characterized by the circuit breaker, and subsequently also public was discouraged to leave the house, and for many months, most Singaporeans have been working from home. So in the whole year, there's a 20% increase in crisis calls compared to the previous year, 2019. A lot of these are reported to be due to conflicts with romantic partners and family members, causing a lot of emotional distress. Okay, let's see what this Straits Times article talks about. So a spike in calls to SOS as more distress in amid the pandemic, right? Okay, so they also receive, when people have contemplate about suicide ideas, and at times, sometimes we advise our patients to call SOS, right, as a crisis kind of measure, just for someone to talk to. And we can see that there are other problems with family relationships as well. During the circuit breaker, other countries call it a lockdown, right? China was the first country to go into lockdown. And what the social scientists and the divorce law agencies, right, they found that the divorce rates really spiked during the time of coronavirus quarantine. And this was experienced on the national level in all the major countries: Spain, Italy, all the countries with major lockdowns. The family lawyers had made a lot more money because they were receiving a lot of inquiries about divorce, especially during the time of the lockdown. I'm not sure whether this is mirrored in Singapore, but from the SOS data, it seems like there is definitely more marital strain during times of circuit breaker and working from home. Also, there was a big issue with domestic abuse. While in the past, the victims of domestic abuse could leave their houses, for example, to take a walk in the garden or go shopping, to escape the traumatic experiences at home. During circuit breaker, they were almost legally bound to stay at home. So they were in effect forced captivity with their abuse perpetrators. You can imagine how distressing that may be. So the abuse may come in different forms, right? What we are most familiar with will be physical abuse, whether it's towards children, towards the elderly. In Singapore, sometimes you see in the news that the foreign domestic helpers, our foreign helpers, some of them may get abused when the families are stressed out, right? So all these victims of abuse, they really had a hard time during the lockdown. Okay. Of course, there is also just verbal abuse or psychological abuse. Okay, so let's move on. So how to manage relationships and prevent further family strain, marital strain, and also with our partners, our spouses, with our families, that our parents, or for those of us who are taking care of elderly parents at home, and also children, right? So spending more time together does not necessarily mean more conflict, right? easier said than done, but we should all make greater efforts to practice kindness and patience to each other. Um, and not let the more time spent together translate to more conflict and strain, right? Give each other some breathing space, especially when we are expected to work from home. So I'll share with you some practical devices, some aids later that we can use. Okay, while we are on the topic of relationships, also not forgetting that we used to go to office and have to have colleagues to chit chat with, water cooler time, right? To gossip about, to but now there's no face-to-face interaction. So naturally that may lead to more miscommunication between colleagues. So what the experts advise will be to buddy up with your colleagues, stay in touch with each other, even though you are not seeing each other anymore. Working in teams will help, right? So maybe the office can be split into different split teams, right? Each team may have 3 to 4 members. And within the 3 or 4 of you, really also try to bond over and beyond just doing work together, right? Staying connected digitally, even though there's no face-to-face. And working from home also introduces other practical barriers to effective work, right? Some of us, for me, I'm really frustrated every time the IT issues. There's something down with the problems with the Wi-Fi, internet connection, or IT issues. So this can serve to create more work stress as well as also cause more miscommunication between workers. Right? And for those of us who are lonely, do pay attention to your psychological needs, or you may have more time because you are no longer traveling, so you have more time to devote yourself to the hobbies, maybe spend more time preparing good breakfast for yourself, or stay connected with your friends through Zoom and WebEx and WhatsApp videos, even though you are not meeting them outside. Okay, so home-based learning is almost like a nightmarish term for parents who are required to work from home. My my kids are like in baby and toddler, right? So they are not going to formal school yet. But my friends who are parents of school-going kids, primary school, secondary school, they tell me that it is impossible to work from home and do home-based learning. And so their work quality will suffer when they have to supervise their children home-based learning. Thankfully, the MOE, in conjunction with National Library Board and HPB and MSF, they actually came out with this 3-part home-based learning kit for parents on how to guide their children, for students, right, to do home-based learning. And they actually have very practical tips. For example, we know that working from home and supervising your kids can be tough. So what to do when my children interrupt me too frequently, what to do when my children are bored, what to do when they cannot stay focused to complete their homework effectively, and they are spending too much time looking at the screen, right? This is part 3. So there's 2 other parts. You can just Google MOE home-based learning kit and all these resources will come out. It's quite interesting. The tips are very practical. For example, adjust your expectations. With kids around, you probably cannot sit down for long periods to focus on your task, right? So just mentally adjusting your expectations about how it may affect the quality of your work, or how you are not able to concentrate for 2 hours at a go, that mental preparation will put you in a better position to tackle the challenges, right? Breaking up bigger tasks to smaller segments so that you can attend to your children in between the smaller tasks, right? Be kind to yourself, give yourself some incentives and rewards to stay on track. Remember that you need breaks too. Join in your children's activities to get away from work and spend quality family time. Okay, then this number 4 is something that I want to emphasize specifically. So modeling the behavior which you want your kids to take over, right? Putting away your work laptop and switching off the computer when you're done with your work, or limiting your screen time as much as you want your children to limit their screen time. Okay, so the kit introduces some practical device we can use, such as this. We can write on the timetable, like mommy is having a meeting from 10 a.m. to 11 a.m. You can paste it outside your study room so that your kids and your spouse will know what to expect. And that 1 hour is really your family will know that you'll be engaged with your work and no one should bother you, right? Of course, it will take some time for your kids to adjust. In the first 2 or 3 times, they may still knock in the door, dash in, and ask for your attention. But after the learning process, after some time, hopefully they get a hang of it and they know what to expect, right? So daddy is having a meeting from 2:30 to 3 p.m., right? Okay. So putting something like that outside will prepare the whole family mentally for the day, right? And of course, you can also put in dedicated slots for your children. Like 9:30 a.m. to 10 a.m. is to supervise our boy for English lessons, right? Okay, so we talked about practicing more kindness and patience to family and friends, right, and co-workers. It's really easier said than done when we ourselves are stressed, right? So translating words to deed, and what I mean is that first we need to take good care of ourselves, right? Be kind to yourself first. So not just being compassionate to others, but we talk about self-compassion, and we can see how we can do this. Managing stress effectively within ourselves, so that we are more mentally resilient, and so that we can then better take care of the needs of others, right? When we are well taken care of by ourselves, and then we can practice kindness and patience that much more practically to other people. Cultivating gratitude, something that's more psychological, which I'll talk about later. So caring for yourself, how to manage stress effectively during working from home or just during the era of COVID-19 in general. It's really no rocket science, right? But these are the things that we will forget. We will definitely forget from time to time. When we are stressed, we start to binge. We may stock up on chocolates and tidbits, right? And engage in, maybe all sorts of unhealthy habits, right? Whether it's with our diet or to stop exercise completely because our sleep hours are screwed up and we are stressed and we have just no motivation to exercise anymore. And taking care of your sleep. So really it's to remind ourselves from time to time that in order to work well and to take good care of our families and be kind and patient to others, we first have to take good care of ourselves and eat healthily, have balanced meals. The science behind this shows that the colorful foods and fruits, the more brightly colored they are, strawberries, blueberries, green, yellow bell peppers, for example. These colorful fruits, they serve to boost the good chemicals in our brains, right? And also nuts. So nuts and fruits, vegetables, just having a balanced diet in general is more important. So that's how we can take good care of ourselves nutritionally. Looking into the exercise part, physical exercise not only strengthens our bones and our muscles, but they also boost the good chemicals called endorphins in our brains. So the more stressed we are, actually, the more we should exercise. Because the exercise is almost like a natural medicine for depression, anxiety, and for stress. These are the things that will suffer during work from home, because if you will tapao food for 3 meals a day and then the food panda will arrive outside, and you will not exercise because government says we cannot go out, right? So you can still go out and exercise, go jogging, go swimming, right? Sleep will naturally suffer when we are cooped at home all day with no sunlight exposure, right? Relationships, what we've talked about, the main principle is really to practice patience and kindness, but do it to ourselves first before to others. Not forgetting that all of us will still need our own hobbies, our own me time, right, to do the things that we like. So avoid the vices, right? Smoking too much, using alcohol to fall asleep, using alcohol to cope with stress. For some of us, it could be binge eating, binge shopping. For some of the younger guys, for a lot of students, it is indulging in computer gaming the whole day, or unhealthy internet use, just binging on YouTube videos the whole day, neglecting work and family as a form of escape from the stresses of life. Right? This will not solve any problem, but will just compound the problem, right? Okay. So essentially paying attention to your thoughts, your feelings, and your needs. And your needs will include not just your physical needs, like all of the above, but also your emotional needs, right? In terms of your relationships, your rest, and your hobbies. So this is really not a tip, but it's more a reminder to all of us, which we will do well if we bear this in mind from time to time. So which vulnerable vulnerable groups are more prone to chronic stress during the time of a pandemic, right? That will include some of us who are exposed to COVID-19 and are being served a quarantine or stay home notice. My sister was inadvertently exposed last month and was called up for quarantine order at a hotel. So some of us could see that as quite a fun experience, right? You go to a hotel, free staycation, but you're really confined to a hotel room for up to 14 days, right? So it's really a very stressful experience. And my sister had experienced it firsthand. All of us were anxious and stressed about her as well, right? So that also includes caregivers, parents, particularly new parents. There is an article to say that the rates of anxiety and depression in postpartum new mothers has spiked during the circuit breaker and during COVID-19, right? Maybe because it is more challenging to bring in new foreign domestic helpers these days, and because of COVID circuit breaker, maybe the help afforded by grandparents and other family members could be limited because they're not allowed to really come over the whole day. Right now it's limited to 2 a day, right? And the elderly because elderly who is suffering from dementia, for example, or who have physical needs, when the senior activity centers, the dementia daycare centers close down, their routines are disrupted and they have to get used to a whole new routine with their caregiving needs not being met, perhaps. So it's very stressful for them. Special needs population, we read 3 days ago that the Minesville Center is an adult disability home, which houses more than 100 adults with intellectual disability, right? And they had an outbreak of COVID-19 over there. So these special needs populations, whether they are children or adults, they really have other needs that the rest of us may not recognize, right? For example, people with autism, they really need to stick to a very rigid schedule every day. They are very used to doing the same thing in the morning, afternoon, at night. At night, at 2 p.m., they have to do something. Maybe they have to watch a TV program, and they can't deviate from them. If they are going for a walk in the garden, every evening and every morning, they really expect that. And when it doesn't happen, when their routines get thrown out of whack, they may throw tantrum. They may act out in other ways, or there may be other behavioral or psychological problems which emerge. So can imagine how the COVID-19 and circuit breaker can affect their lives. Okay, those of us with pre-existing physical and mental health conditions, other operations in the polyclinics and the hospitals are also disrupted, right? Routine care may be compromised when COVID-19 cases surge, right? And ICUs have to make room for COVID-19 cases. So we still want to take care of our physical and mental health conditions, especially if they are already pre-existing before the pandemic. Those of us who are staying alone have different problems to contend with. And of course, with the economic recession, because due to the pandemic, disadvantaged families are struggling with poverty already, limited resources, they will be even more economically stressed. Right, so some local articles, elderly being hit hard by social isolation amid circuit breaker measures. This was in April last year, right? So new mothers facing higher levels of postnatal anxiety during COVID-19, right? Feeling isolated and missing family, right? Because they are not able to get the practical help that they need. Disadvantaged families scraping by in a tougher spot because of the economic stresses. Right? Okay, and it's really all of us, right? If you look through the list, all of us will fall into. I talked about those living alone, those living with too many people, those with caregiving duties and all. It's really all of us. So COVID-19 has really taken a toll on people's mental health over the past 2 years. Right? And we don't know when this will end, right? We are constantly worried about the risk of infection, not just for ourselves, but for our families. And it's not just the infection, right? When we don't want to be the black sheep of society, right? There's a stigma attached to being exposed to COVID-19 or to even contract COVID-19, right? Maybe the public may perceive that those who get COVID-19 may be, they engaged in some sort of irresponsible behavior, didn't follow the rules, and when our names or when our details and particulars get appear in the media, it's really a stressful experience, right? On social media, those who are exposed or those who behaved irresponsibly in public, intentionally or otherwise, or may be then condemned by the public. So social distancing measures can lead to a risk of social isolation. They are very different, right? Social distancing, we call it safe distancing measures, right? Or safe management measures, right? Okay, but they run a risk of increasing the rates of social isolation among the public. Containment measures can lead to disruptions in our personal lives. We all remember the days where NTUC ran out of stock of toilet paper, right? Because everyone is stocking up because of stress and kiasu. So in terms of all these uncertainties, extraordinary times, constant changes to work processes, right, and the economic recession, all this will cause stress in all of us, right? But is stress always bad, right? So stress is only bad when it is excessive. In fact, there's a scientific term for good stress, and it is called eustress, EUSTRESS, right? Eustress is good stress, which spurs us into action, spurs us into taking steps to solve problems in our lives. Good stress helps us to perform well in our work, in our roles, whether it's as an employee, as a business owner, as parents, as caregivers. But without stress, you can imagine that we'll be all in this part of the graph. We'll all be bored, disengaged with life. There'll be no challenge. So we want to strive to be in the green, yellow, and sometimes in the purple zone, where there is optimum performance across these three colored zones: comfort, stretch, and strain, right? But when we are strained too much, when stress becomes excessive, it results in fatigue, poor judgment, and over the long term, it can lead to a crisis, right? When we are exhausted, when we start to develop mental health problems, when we suffer from burnout. So it helps to consciously observe the levels of stress that we are in and kind of like moderate it. Like if we are in the red zone, try to nudge ourselves back to the purple zone or the yellow zone. And if we find ourselves in the blue zone for whatever reason, maybe we are completely giving up already, right? And we refuse to acknowledge that maybe it's not stressful, there's no challenge in our lives, right? Then we want to take on more challenge and more hobbies, more responsibilities even, right? To nudge ourselves to the green and yellow zones, right? So that's where good stress is at work, and we want to avoid the effects of that bad stress. So this applies to our work performance and also to our roles as parents, as friends, in every role that we play in our lives. Okay, so a bit about work-related or occupational-related burnout, or if you're working from home or during COVID-19, it is a state of emotional, physical, mental exhaustion due to poorly managed and prolonged excessive stress states. We may be unable to meet the work and life's demands any longer, and we may disengage, feel apathetic, feel like a failure. Okay, and complications of burnout, which really just means chronic stress, right? Stress is not being managed properly. Right? Professionally, we will have a lower job satisfaction, productivity will get affected. In the work organization, there'll be increased rates of errors, reduced staff morale, higher MC and turnover rates. Right? But on the personal front, perhaps more importantly, right, higher rates of family discord, divorce, substance addictions, whether it's smoking, alcohol addiction, even caffeine addiction, right? People who drink 10 cups of coffee just to stay awake at work or just to keep on track and stay focused. Increased rates of anxiety and depression. Increased RTAs is road traffic accidents, stress can lead to poor sleep, higher rates of road traffic accidents, and physical impact on our physical health. Chronic stress and burnout, when not managed properly and when it's lasting for years and leading to anxiety disorders, can really affect our physical health. It increases the rates of obesity, diabetes, can cause high blood pressure. Over decades, poorly managed stress can also increase the odds of having cancer. right? Because there is an impact on our immune system, and our immune system helps to keep infections at bay, but also cancer cells, helps to kill off any early cancer cells that may arise just spontaneously, naturally in our systems. Um, also, psychological stress, burnout can really affect our physical health and also reduce our life expectancy. Right? There are studies that are well known for showing that life expectancy can reduce, when we sleep less than 7 hours a day, for example. But this is over decades lah. Okay. So the first step to address burnout is to recognize it. Some warning signs, as I mentioned, you may feel apathetic, like you don't care anymore. You may feel irritable and frustration, not simply just feeling depressed or sad, right? Some of us manifest that sadness by way of anger, right? Frustration, taking out on other people. We may withdraw socially from friends and family. We may feel physically exhausted, tired all the time, right? So the top 4 points are more like sub-threshold depressive symptoms. So meaning they don't quite reach the point of having clinical depression yet, but it's like on the way there. So if you recognize all this in us and they are lasting for more than 2 to 3 weeks, do reevaluate and practice more effective stress management. Right? Okay, going down is excessive worries, catastrophizing, thinking the worst of every situation, right? Feeling constantly nervous, maybe insomnia, panic symptoms, like physical sensations that are manifestation of stress, like chest tightness, palpitations, hyperventilating, right? Breathing too fast, or having the sensation that we can't breathe. I have patients who vomit when they are stressed or when they are anxious. They feel that they're trembling and their palms and their skin are all sweaty, right? Some of us may have nightmares about work, especially if we have made some mistake at work, right? Or if we have an abusive kind of superiors, right? So do recognize all these symptoms and try to monitor and observe if you're having any one of these. Okay, so simply put, healthy versus unhealthy coping. Some of this is really a rehash of what we've talked about, but it's the basic things. Remember to eat well, drink when you are thirsty, sleep well, exercise, connect with others, taking a pause and mindfulness. Okay, so really not just reacting to any situation that you come across. A lot of us lead our lives, especially when you are stressed, quite mindlessly. And what I mean is that we are just responding to stimulus when there's we're just following the signs on the traffic lights, or responding to cues in our environment. When my wife shouts at me, I shout at her back, right? When my kids disturb me at work, I push him away, right? When my colleague is unreasonable, I reply with a rude email. It's like I'm just reacting, right? There's no self-agency. So that's quite mindless. But what will help if I take a pause and reevaluate and try to respond to the situation rather than react. So that's the difference between responding and reacting, right? Reacting is like it's not going through your mind at all. You're just reacting. Responding means you're actually taking a step back, observing the situation, analyzing the situation, and regardless of how you're feeling, whatever negative emotions you're having, but consider your options and then responding with a more mindful, more strategic kind of action, which will help everybody. For example, instead of replying with a rude email, I may then text the colleague who was rude and unreasonable with a message of concern. How are you? How have you been? I noticed that you have been feeling stressed, right? So it becomes an opportunity to build a relationship with the colleague rather than replying a rude email, right? Okay, so relaxation techniques, like what Angie brought us through just now, a bit of a progressive muscle relaxation, deep breathing techniques. Inculcating these relaxation techniques in our daily lives will definitely help to reduce our stress levels. Journaling and reflection has also been scientifically proven how to reduce burnout and manage stress effectively, right? And the ones that we should avoid. So I've talked about alcohol, smoking, excessive caffeine, right? Binge eating, excessive shopping, right? Displacing anger to less threatening targets. For example, if my boss scolds me at work, I may come home and take it out on my wife and my kids, right? I may scold them, but because then they become the victim of my work stress, right? The problem is with the boss and my work stress, but then it becomes a family strain because I'm displacing my anger to less threatening targets, which my family members, right? So that's something we want to avoid. But actually, all of us do engage in these unhealthy behaviors from time to time, right? Is to catch ourselves at that moment and then try to analyze it and remind ourselves not to do it again, right? Impatience and aggression, avoidance and escape, right? Things to avoid, unhealthy coping versus the healthy coping, right? Okay, so that's all about caring for yourself and managing stress effectively. Okay, now I'm going to talk about something more like psychological and philosophical about cultivating gratitude and how evolution actually sets us up for having a lot of negative emotions in our lives. So my psychologists will call this our caveman mentality. All of us evolved around over millions of years, right? From reptiles and fishes and mammals, right? Okay, we are still mammals, right? But the human race, Homo sapiens, is actually human race is only existed on planet Earth for the past 200,000 years, if I'm not wrong. So that in that 200,000 years, where we evolved from cavemen and hunter-gatherers, hunting for food, planting crops and all, what our ancestors, what kind of genes they passed down, right, are the genes that allow us to do the following: to worry non-stop about the future, to remember bad things that happen to us, to anticipate new things that can go wrong. So if you look at this, our DNA, our genes are really setting us up to worry non-stop, to remember all the bad things. We are always living in the future where we worry and plan, right? We are also living in the past, in the form of resentment, grievances, bearing grudges, unable to let go of that traumatic memory which we experienced in our childhoods, right? So we are always living in the future and our past, and we are hardly living in the present. Okay? And that is really the natural state of the human mind. And it's something that is no longer helpful for us in the modern world, right? Because these skills help us to survive the wild. They help us to remember that there is a tiger on this route of the forest, right? And to avoid that path. Or that is remembering the bad things that happened because we were attacked once. Or to plan about the future, whether there's enough food for the family in the next winter, right? Whether there is whether how to prepare for weather, right? Whether to gather all the resources. But in modern life, modern day living, we no longer have to worry about all this day-to-day survival. We are all equipped, especially in Singapore, right? But the problem is with happiness. So all these skills help us with our survival, but not with happiness. So what we really have to do is to try to get out of this mode. It's almost like working against your genes, which is not easy to do. But Barbara Fredrickson, who is a Canadian psychologist, will say that the negative screams at you, but the positive only whispers at you. So what we want is to try to tune down the negative screams and to tune up the positive whispers. Right? And that is where cultivating gratitude in various ways can help us with that. For example, we can start a gratitude journal where we can write on it maybe once a week, maybe once a day, or maybe even once a month, where you set aside 1 day a week or 1 day a month to write down what you are grateful about for that week or that month. So the science of it, scientific evidence, research has shown that writing one gratitude letter can promote resilience for 6 weeks. And being constantly grateful for things in life, behaving in that way can promote resilience for 6 months. So the gratitude letter can be to anything. It can be to a person, can be to something that happened, it can be to even a stranger, right? But there is more impact if you actually let the person in question know that you are grateful and you are thinking about, that grateful event. Okay, the other way is to write down just simply 3 good things about the day before you go to sleep. That is something that my department practices. Every week, my HOD will get us to write down some good things that happened about the week and email him. Then he'll just compile and send it to everyone. So middle managers, if you are a supervisor or manager, you can also introduce this workflow or this habit into your team, right? It promotes team bonding, and it also helps to inculcate gratitude in your employees. Right? Because good memories are like Teflon. Teflon is the substance in the non-stick pan, right? They just slip away. And bad memories are like Velcro. They stick to you forever. So this is about retraining our brains to remember the good things rather than the bad things in life. Living in the present, right? Rather than worrying about the future and resenting the past. Right? So this is not just a arty-farty kind of thing, but there's solid scientific evidence backing up all these practices, right? Okay, the last one is about getting good sleep. I am particularly interested in this because I run the sleep clinic, right? I have a special interest in insomnia. So let's see what we have. Okay, first to start off, 2 processes which regulate our sleep rhythms. Firstly is the sleep drive, and secondly is the body clock. Okay. So sleep drive simply means that the longer we stay awake, the more sleepy we feel. That's our experience, right? It's consistent. So it's the top part of the graph. The longer we stay awake, assuming we wake up at this point, right? Awake. So we only feel sleepy. We feel sleepy in midday the most, right? And then we may take a nap, if we can. Okay, right. So the part where the arrow is longest, that's where sleep drive is the strongest, and we fall asleep at night. Okay, the other part is the circadian rhythm or the body clock, right? It is governed by glands in the brain which produces melatonin when there is no sunlight, in times of darkness. So when the sun sets and the moon comes out, melatonin increases in our brains, right? And then we feel sleepy, right? So you can imagine for night shift workers, actually these 2 rhythms, these 2 processes are in conflict. They may feel very heavy sleep drive in the morning because they just finished a night shift, but their circadian rhythms or their body clock is asking them to stay awake because the sun has been up, and their melatonin is not being secreted. Okay, but for most of us who work in the day, the 2 rhythms, these 2 processes are synchronized. Okay, so insomnia is very common in Singapore. 15% suffer from insomnia at any one time, right? And 30% of us will have some form of severe insomnia at some point in our lives. Right? Singaporeans sleep on average 6.5 hours, which is short of the recommended 7 hours. That's the international recommendation. Singapore is consistently voted or surveyed to be the second most sleep deprived country in the past few years. Right? Japan is the most sleep deprived country. But if you rank it in terms of cities, if you consider Singapore as a city, then actually New Yorkers and Londoners have less sleep than Singaporeans. Okay, right. So COVID-19 and sleep. When there's more anxiety about the pandemic, when there's more worries, more stress because of job insecurity, caregiving duties, working from home, naturally we can't sleep as well. And when we are asked to work from home, our routines are disrupted. We are indoors all day, we don't get sunlight, right? When we don't get the sunlight in the day, our body clocks are not as strong. It's not as entrenched, right? So for example, if we are always indoors, maybe melatonin gets secreted in the brain even at midday. So there is not enough stores of melatonin to get a surge of melatonin at night. And then you can't really sleep at night. Your sleep will be disrupted. So what you need to do is to go out to the sun in the day, right? May not be midday, right? When the sun is at its highest, but we'll talk about it later, right? Okay, so when we are not commuting to work, not driving as much, not taking public transport, not walking as much, this reduction in physical activity also reduces our sleep drive. So we're just less tired when it's time to go to bed. Some of us even worse, right? We work in bed. As a student, I used to study in bed. I study for my O levels and A levels in bed. So I had severe insomnia. I never knew about all these concepts. Right? So long hours spent in bed, especially for work, classically conditions our brain to associate the bed with work stress. So it's not just the home. We are not just associating the home with work stress. We are literally associating the bed with the stress that we have at meetings and unpleasant emails and, and office. The bed becomes our office, right? So that is a sure recipe for insomnia, right? Because every time we hit the bed, our brain will think that we are going to work. Okay, some of us may engage in oversleeping in the day when we are working from home, right? Which then, of course, then it impacts our sleep drive at night. Okay, so there are all these articles, local and overseas articles, right? How COVID-19 has disrupted our sleep, how working from home has disrupted our sleep. And it's all the more important because we need an effective immune system, right? To combat COVID-19, if you are exposed to it, and to not get cough and colds and flu, and then you have to go for a swab test, right? Because you'll be suspect COVID-19, right? So we need our sleep for a good immune system, for good brain functioning, for memory consolidation and learning, to keep us in a okay mood, stave off depression, anxiety. So all these things will suffer when we don't get good sleep. So some tips to sleep well during circuit breaker or working from home. Okay, so watch your stress levels, limit consumption of COVID-19 news if you find that you are easily triggered by COVID-19 news. Keeping a consistent sleep-wake schedule, right? Going to bed at the same time every day, and if that's not possible because you are not able to fall asleep on demand, then at least waking up at the same day every day. So if you set your wake time at 7 a.m. every day, naturally your bedtime will calibrate to the desired bedtime. Okay. Here I've talked about having a clear demarcation between work and non-work areas. Not working in bed is very important. Point number 6, right? Not working in bed. Work in your study, right? And when you're in your bedroom, leave all your devices outside. Don't bring it into the bedroom at all. The bed and the bedroom is a place of peace, tranquility, relaxation, pleasant memories, rest, and sleep, right? Sleep is awesome, right? It's something to be grateful and thankful for. It's something that's peace, nothing to do with work and stress, right? Okay, avoiding late afternoon naps, and if you have to nap because you're too tired, to limit your naps to less than an hour. Okay, get more exercise and sunlight. Okay, so my friends who are in dermatology, right, they were specialized in skincare, will say that sunlight will cause aging, right? Will cause 老人雀斑, 黑斑, all this, right? So maybe avoid the sun at midday lah. Avoid the sun from maybe 10 a.m. to 4 p.m. Don't go out to the sun. But in the early mornings or in the early or late evenings, do get some sunlight. That may be a good time to exercise. It's not as hot. And it's a good time to get sun, where sunlight is not as damaging to your skin. And you still get the benefits of sunlight, which includes good sleep and good bones, vitamin D, and prevent osteoporosis, right? Sunlight. Okay. So once again, refrain from the bad habits. In this case, alcohol because it disturbs sleep. Smoking because nicotine can stimulate your brain and disturb your sleep as well. If you're playing computer games late at night, you can't go to sleep because it's so stimulating, right? Okay, so just these 5 tips and some details about each of them. Demarcating work and home areas and hours and psychologically. Managing relationships with family, co-workers, the elderly parents, or the young kids for home-based learning, right? And your friends. Taking care of yourself is more a reminder because all of us know this. It's just that we forget all these things from time to time. Essentially paying attention to your thoughts, your feelings, and your physical and emotional needs. Cultivating gratitude, something that you may not buy it, but if you start doing, you will realize what good it can do for you. Okay, and sleeping well during working from home, circuit breaker. So where to seek help? If you find yourself constantly stressed, anxious, having panic symptoms like chest pains, hyperventilating for no reason, especially if you don't have a risk of heart disease, right? Or a lot of these panic symptoms can mimic a heart attack, right? If you're having these symptoms constantly for more than 2 to 3 weeks and your sleep and appetite are significantly affected, you may be gaining a lot of weight because you are using binge eating as a coping mechanism. You may be losing weight because your appetite may be affected and you're missing meals all day, right? So whatever mood changes or anxiety which are affecting your family life and work performance significantly, right? It may be some warning signs and some indications that may be worthwhile to seek help. Okay, feelings that life is not worth living, and even worse, suicidal thoughts, right? Thoughts that about ending our lives, right? So where and how to seek help is up to you. Most of us probably go for the last option first, right? Talk to friends, talk to family, talk to our religious group leaders. This is also what most of my patients do before they come to see us in the hospital, right, in the clinics. So which is okay. Sometimes family and friends and religious leaders can offer the support that you need. And this depression, anxiety kind of symptoms just go away after you learn to take good care of yourself for a while. That's okay. Then you don't really have to seek professional help. But what if it doesn't work? Do talk to your counselor and social worker at every family service center. Right? Every neighborhood in Singapore has a family service center, and they provide free counseling services, most of them, right? You can also approach your family doctor downstairs for a chat. And if you want to seek professional mental health services from the hospitals, you can also, at subsidized rates, you can seek a polyclinic referral. Otherwise, you can just call into any major hospital in Singapore and book an appointment to see a psychologist or a psychiatrist, right? And the government has also come out with all these helplines, right? There is a national care hotline for the worried well. They call it, right, for those of us who are worried, stressed, anxious about COVID-19, stressed about working from home, circuit breaker, and some community partners. These agencies, they offer counseling, psychological support which are free or at very low charges. Okay, there are very specific ones, right? Some more general about mental health mental well-being. Okay, some about marital and parenting issues. Then there's the ones with who specialize in family violence or family abuse. Okay, some specialize in counseling. And of course, Brown Center is one of them, right? Specializes, I think, in mindfulness courses and all. So some of my patients have gone for the mindfulness courses at Brown Center, and they tell me it's very, very good. Okay, this is my last slide. Okay, I welcome any questions. Angie, back to you.
Thank you so much, Dr. Tay, for the excellent presentation and the comprehensiveness of what you have offered. So some of the questions have already come in. So would you like me to read them to you, or would you just like to read them yourself? They're in the Q&A box at the bottom of the screen.
Okay, let me see whether I can access them. Q&A box, is it?
Yes, do you see Q&A? The first question yes, is from Mr. Chua. So I think it might be easier for you to read it.
Okay. So Mr. Chua asked, what are some of the key neuroses that an individual needs to be aware of given this restricted work schedule now? Okay. So the term neurosis refers to, if I can put it in a layman's way, it's just stress or stress related conditions, which are not really it's not like serious or major mental health problems like schizophrenia or psychosis, but it's really things that we struggle from day to day. So the common disorders that I see that are increasing because of COVID-19 and working from home are mainly 4 types of neuroses, if you can put it that way. We are more prone to anxiety disorders, if we are always worrying about COVID-19, and which reminds me that of OCD sufferers, obsessive compulsive disorder. OCD sufferers, they may have a obsession with cleanliness or with hygiene, or very, very irrational fear of contamination. Sometimes the safe management measures like hand washing and all, really, they run a risk of having their OCD getting worse, because they are all the more that paranoid with COVID-19. Okay. There is also an increased rates of depression, adjustment disorders, and insomnia. These are the consequences on a national level and individual level if stress is not managed well. Okay, so do try to adhere to the 5 tips that I laid out. Then maybe we can prevent this from happening. Okay, Miss Neo asked about, how do you think we can demarcate the boundaries if the boss likes to use WhatsApp chats for work discussions, which make it hard to break away from work? Okay, very good question, very practical. Okay, so what I presented is the ideal, is the ideal situations, right? Ideal outcome, right? But sometimes we are also limited by the realities, right? If our company or our boss or the nature of our work requires us to somehow not keep to any regular work hours, if our boss is someone who don't really follow work hours, some bosses may hold meetings at ungodly hours or text important work messages at 2-3 a.m. Right? So if your boss does that, I don't really expect him. I don't think he expects you to reply straight away. I don't think he expects all of you to respond immediately and go and check your emails. It's probably acceptable to reply the next day in the morning. So maybe if that's the case, maybe it is even wiser to put your handphone away, leave it out of the bedroom, so that your boss, when you check the WhatsApp tick, at least the tick is not a red lah. If it's double tick blue and it's like red, right, then you better act on it. But if you're not even checking it because you're asleep or resting, because you're spending quality family time, it's probably okay to reply the next day lah. I think your boss will understand. If your boss really expects you to reply, then I guess there's no choice, but you have to find other way to work around and still manage stress and still kind of enjoy your work, not break down mentally, and still have a good quality of life. Okay, so practically, if my hunch is right and your boss don't expect you to reply immediately, then put your handphone away for the night, reply the next day. If your boss sees that you're not reading the messages, he will assume that you're asleep, and that's okay. Okay. Okay, Mr. Chua asks, what are the most effective coping mechanisms without much effort? Okay. Yeah, it's back to basics. It's not rocket science. It's the tip number 2 and 3 that I talked about: managing your relationships in your life and taking good care of yourself. Taking good care of yourself is all that more important because you have to take good care of yourself first before you take good care of others. And that's how you then preserve, maintain good relationships with family, friends, and co-workers, right? And avoiding things to avoid are just as important as things to adhere to, right? So we talked about vices, right? Smoking, drinking, gambling, for some of us, excessive binge eating, indulging in video games and escape, like binge watching videos the whole day. All of us probably do that from time to time, which is okay. But just be careful that we are not using it as the main coping mechanism for all sorts of stressful situations. Okay. So Angela asked about how to deal with seniors who are depressed. Okay. Very good question. Okay. Yeah, seniors have a unique set of challenges to contend with, right? Whether it's in the era of COVID-19 or not. Most of them, if they are retired, they may be contending with a lot of loneliness at home. So I see that in a lot of my elderly patients. Loneliness seems to be the main problem. You can call it depression. Some of them may or may not qualify to have clinical depression. They may or may not need antidepressant medications, but all of them will benefit from alleviation of their loneliness. That can come in many ways, right? Kids and family and siblings can try to spend quality time with them, visit them when circuit breaker is over, bring them out in mask to parks and gardens, outdoor spaces, where the risk of infection, transmission of COVID-19 is not that high. Some of them really benefit from going to the senior activity center or the day centers, where they naturally will meet friends, play mahjong, listen to music, sing karaoke, and it provides them with a natural circle of friends when family has to be at work, right? So, but if the elderly person is depressed to the extent that they are losing a lot of weight, not eating well, some of them start to hurt themselves, like they hit themselves, or they say things that, 生活没有意思啊，我不想活了, life is not worth living, right? It's really quite meaningless, and you see that it's really quite severe. Then bring them to seek treatment with either the family doctor downstairs or one of us in the hospitals. Every major hospital in Singapore has a psychiatry and psychology department, which has expertise to treat elderly depression. Okay, but the first tip will probably be to look into how to reduce their loneliness, spend more quality time with them, and try to apply for the senior activity center nearby. Okay, right. So anonymous attendee says that writing in a journal, introspection, reflection are taken to be healthy coping. I've been trying to do this, feel good penning down my thoughts. How can I avoid a downward spiral of emotions? Okay. Sometimes I reflect too deeply and I cry and feel sad afterwards. Okay. And actually made me withdraw from others. Okay. Okay, right. So the sadness and tearfulness that you have after journaling, they may be, I don't see them as necessarily bad or unhealthy. I think they are good ways to have some catharsis or to process your emotions. At least you are realizing that you are sad and unhappy, and you probably after reflection will be aware of the reasons. So the problem solving mode may be to go and resolve those problems, right? Whatever problems or reasons that is causing you to be sad and unhappy. But the crying and the sadness in itself is probably more good than bad, I feel. Of course, if you are having really severe suicidal thoughts, do seek professional help. Withdrawing from others for some time is also okay, but try to beware that it's not going to be your main mode of coping. Or this social withdrawal. It's probably good to re-establish your relationships and touch base with other people who truly care for you. So it could be your family or your friends or or your siblings, your colleagues. Could be anyone. Sometimes we find it more easier to talk to people whom we are not so close with. So maybe a stranger on some, I don't know, but it comes with its own risk, right? Stranger on some online chat groups, okay? Or calling the SOS helpline, where it's essentially a professional, but a stranger talking to you, right? So you can call the helplines, which I flashed out in my last screen just now, if you find that it's easier to talk to strangers than to loved ones. Or otherwise, think about who you think really you can trust and is truly concerned, and reach out to the person. You can see talking to the person as a verbal way of journaling and introspection, especially if the person is truly concerned, and especially if the person is hopefully someone who doesn't pass harsh judgments readily, someone who is good at listening, someone who doesn't like to talk so much and pass judgment so easily. Okay, the next question is, when I wake up at 7 a.m., I am never sleepy until 2 a.m. Can I take melatonin tablets? Okay, yes, you can. You can take melatonin tablets, is the short answer. Melatonin is a natural supplement that is produced naturally in our brains. It is sold over the counter at Guardian Pharmacy, Unity, right? Watson and all. So it comes in 2 mg formulation, and it is really giving you that boost of sleepiness. So melatonin can help with bringing forward your sleepiness to an earlier part of the night, if that's what you really need to do. But I wouldn't focus so much on insomnia as I would your daytime functioning. If you are functioning well, in tip-top condition, doing your work well, caring for your family and the household well from 7 a.m. to 2 a.m., and then you sleep for 5 hours, and somehow you're still coping well in the day, I think the daytime function is more important than just looking at the number of hours you sleep at night. So it's also the quality of your sleep, not just the quantity of your sleep. Okay, but 2 a.m. to 7 a.m., 5 hours is a bit too short. I would like most of us to achieve at least 6.5 hours, so that at least we are on par with the average Singaporean. Okay. Having said that, it's not every day that I expect to sleep 6.5 hours. There are nights that I sleep 4 hours, then I make up the next day, then I may sleep 8 hours the next day. So there may be good nights and bad nights, which is actually okay as long as you are still functioning well. Of course, the ideal is to keep to a consistent sleep and wake schedule, and wake up at the same day every day, go to bed at the same time every day. That's the ideal. But sometimes the ideal is aspirational. Most of us struggling from day to day, stressors, we expect good nights and bad nights. Okay. Okay, so what I have, another practical advice to help you feel sleepy at the right time is to engage in a pre-bedtime routine. So my sleep psychologist will advise his patients to engage in a 30-hour sleep routine before bedtime. For example, you can mark out 30 minutes before you go to bed. And in that 30 minutes, what you should do is to do some relaxation activities in the same sequence, in the same order, every night without fail. These 30 minutes of a routine will prepare your mind and your body to fall asleep. So some suggested activities could include some light yoga, stretching, having a warm glass of milk, having a light snack, listening to relaxing music, or some light reading. Okay? Avoid those horror stories, adventure thriller kind of stories. That will just stimulate you and then you cannot fall asleep after that. Okay, so 30 minutes without fail every night to prepare your brain and your body to fall asleep. If we are spending 1/3 of our lives in bed, in our sleep, it is definitely worthwhile to spend 30 minutes to prepare for it. Okay. Jocelyn asked whether I will recommend to people with whose physical environment will not allow for demarcation. Okay, wow, very, very real problem, right? In this age of shrinking living spaces, and some of my brother-in-law bought a loft unit. It's a 2-bedroom living space, right? So some of us we are just confined, right? Property prices are so high, right? Okay. Bedroom is also the study, Okay. So at least you can demarcate the bedroom. Make sure you are always working and studying at the same place of the bedroom. Maybe don't study in bed or work in bed. Don't lie down or sit in bed. You can, if you can work. Maybe, there are those tabletops where you can put on the floor, and then you can sit on the floor and work next to your bed if living space is really a constraint. But even within the bedroom, I think you can do some demarcation, designate work areas and sleep areas in your bedroom. So at least there's a psychological demarcation. Then if you can't really do the geographical or the spatial demarcation of the boundary as well, then you probably have to rely more on psychological boundary or temporal demarcation. Also being very, very disciplined about work hours and doing some routines before and after work, like changing into formal work clothes, going for walks before and after work, going for a bath before and after work, to psychologically transition from your work identity to your home identity. So maybe even if you have to stay in the bedroom all the time, at least you have that 2 other ways to demarcate. And that's going to help work from home. Okay, another attendee asks, how do I as a family member better support my loved ones who are suspected experiencing burnout? Okay, so the first step is to at least be patient and kind to them, right? Don't displace your stress onto them, right? That's the first step. But how to support them? Okay, I don't know how to answer this apart from you can ask and listen. Show concern by asking, and then just listen to what they have to say. And if they are not willing to share much, then say that it's okay that you are there for them, and that talk to you when they are ready. Yeah, that's probably what I would suggest. Don't have to force them to say and talk when they are not ready to. Or maybe there's not much maybe they'll get better by themselves. But just reassure them that you are there for them, and offer your presence and your attention when they are ready to talk. So in short, be kind and patient, and then ask them, and then listen to them. Listening to them is more helpful than giving them advice. Just listening, the listening ear is very therapeutic. Okay, thank you, Mr. Chan or Mr. So, for your encouragement and compliments. Okay, someone asked about alcohol. Refrain from alcohol. How about drinking Benedictine Dom? 40% alcohol, that's quite high, daily before sleep. Okay, right. So the experts actually found that, drinking a bit of red wine every day used to be good for your heart and all, right? Okay, but the evidence is somewhat mixed after that. The scientists cannot really agree whether the alcohol, even in small quantities, poses any benefits more than harm. As a psychiatrist, I will say if you can, just avoid alcohol completely. Alcohol is a central nervous system depressant. So in the short term, alcohol helps you to sleep. That is true. Okay. However, in the long term, alcohol disrupts sleep for sure. Alcohol may help you to fall asleep, but alcohol disrupts the quality of sleep. So the stage 1, stage 2, up to REM sleep, right? That one goes haywire with alcohol. So even though you are asleep because you drank alcohol, you may wake up feeling even more awful. You may wake up with a hangover. Even if you don't, the brain studies, right, when they attach the brain electrodes to study the brain waves when people sleep with alcohol, the sleep stages are all over the place. The sleep is not as consolidated. And in the long term, it definitely causes more harm than good, I feel. So what I can suggest is maybe if you have to rely on alcohol to sleep, in the short term for a few days is probably okay, but for more than a few days is probably not good. You have to rely on your lifestyle, like the getting more sunlight, exercise, having a consistent schedule, and having a pre-bedtime, 30 minutes pre-bedtime routine. All these things to help you to sleep better without using alcohol. Okay. So if you have to use alcohol to sleep, use it in small amounts, and once in a while is probably okay. Okay. But not consistently. Okay, so Brian asked what I recommended advice to the company to help employees. Okay, so that's good, right? So that relates to our first question just now about the boss who expects 24/7 attention and responses on WhatsApp, right? So part of our job as healthcare professionals is probably also to educate employees, educate employers and companies lah. So educate the managers and the bosses, right? They have to play their part for us to have a good quality of life while we are working from home. So if I were to give advice to the company or the employer or the boss, it is to help your employees achieve that 5 tips that I laid out, and to check in on them once in a while, ask and listen, respect their work hours. Maybe after 6 p.m. Even if you message them, don't expect them to reply straight away. depending on the nature of the work, of course, some of our jobs require immediate attention, right? Okay, so good bosses, interestingly, is the crux of having a good work life, right? Often how satisfied we are with our work relates directly with how our bosses are, how well our bosses treat us. This is more important than the values of the company and the mission and vision of the company, right? So bosses out there, do take care of your employees, take care of your team. Everyone is more stressed during this period. Okay, to be fair, a lot of employees thrive on work from home. It gives them more family time, more flexible. All of us will save 1 hour of traveling time when we don't have to travel to town, to the office, right? And with that 1 hour, we can get more sleep. With that 1 hour, we can prepare a good breakfast. We can prepare a good lunch. We can spend more time playing with our kids, taking care of our parents, spending quality family time with the additional hour saved from commuting. So most of us may like to work from home. Some of us may thrive on it, and we will miss it when it ends. But there is that maybe 30-40% of us who really struggle to work from home. And bosses, if you can, try to identify these people and pay special attention to them, right? Okay. Angie, is it okay if I carry on? It never. Okay, I just.
How about take the last question? And yes, more questions are likely to come in if you don't end.
Yes.
I think you're giving very good tips and also suggestions. So I think a lot of people are benefiting from them. Thank you. So perhaps you choose the last question.
Okay, right. Okay, can I? Some of the questions are quite long, so I will just skip to the last one. Eileen asked me what can I do if I lie in bed struggling to fall asleep? Any immediate remedies? Right. So Eileen, this is a very common problem for patients who come to visit me in my sleep clinic. This is the initial stages of insomnia. Hopefully short-term insomnia, but if it lasts for more than 3 months, it becomes a chronic insomnia, and it kind of takes on a life of its own. Insomnia is very interesting. Sleep is something that we can wish for, but we cannot be forced upon. So psychologically, if we are struggling with insomnia, we have to realize it. We have to realize that the more we lie in bed and toss and turn and force ourselves to fall asleep, the more we are not going to get it. Okay. Paradoxically, the less you try to fall asleep, the more easily you may fall asleep. So what you need to do is to spend less time in bed. If you are struggling with insomnia, right, spend less time in bed. If you can't fall asleep at night, wake up, don't lie in bed. Okay, get up, do something in the living room, reading, listening to music, having a light snack, doing some stretching, going for a bath, doing some relaxation activities, preferably not vigorous exercise, preferably not work, but doing some relaxing activities to calm your mind. And then when you are finally tired and sleepy, then go back to bed and try to fall asleep again. But don't try too hard. Okay, so I'm like contradicting myself, right? Okay, so because the harder you try, the more it will be that you struggle to fall asleep. Okay, so if you can't sleep and you're feeling stressed and anxious about sleep, don't lie in bed. That is again classical conditioning, where you are associating the bed with stress and wakefulness and the anxiety of not falling asleep. So we don't want that. You want to start to retrain your brain to associate the bed with peace and calm, tranquility and pleasantness and sleep. So it's not going to work in a few days. You have to persist and try this for 1 to 2 weeks. Then gradually your mind will learn to fall asleep again by itself, without you trying too hard. Of course, if it lasts for 3 to 4 months and you really is struggling and you are struggling to stay awake in the day, then do visit your family doctor to maybe get some very small sleeping tablets for a few days to kickstart that process. It may make a difference. So talk to your family doctor if you find that you have to. Okay.
Thank you,
Okay,
Dr.
that's
Yes, there are many people who have sleep challenges. I may like to suggest that you try using the body scan practice, and you can obtain free audio tracks to be guided. They're on our website as well as on the Brahm Center YouTube page. We also have a course that's called Mindfulness-Based Therapy for Insomnia that's starting in June. Now, what happens to a lot of people who have difficulty sleeping is because the moment they look at their bed, their adrenaline is pumping. So check to see whether your heart is beating faster, your muscles are tensing up, because many of you have had uh, struggles going to sleep. So when you look at the bed, it already gives you this sense of heightened fear. And this then causes your adrenaline to be pumped, which is the last thing you want, right? Because with more adrenaline means your mind is going to be wide awake. And then the more you struggle, the more adrenaline and stress hormones are going to be excreted, and that just perpetuates the problem. So body scan practice may help because it actually relaxes your uh, nervous system, which is the parasympathetic system kicking in, and therefore your stress hormones will now no longer be excreted in the amounts that are actually causing you to stay awake. So, Dr. Tay, would you like to add to that? Did my
Yeah, that's
explanation help?
yes, yes. So Angie's advice is yeah, is really good. It's exactly what I will share with my patient in my clinic. Huh? So Eileen, do try that.
Yeah, and a lot of times, like Dr. Tay was mentioning about spending quality time. Actually, a lot of people don't understand what it means by quality time, right? Because you may be spending time, but you get on each other's nerves, you agitate each other, you get annoyed. So, quality time is learning how to make peace with whatever arises. So, if someone like our mother or father we're taking out, and then they have their usual nag, or they say things that usually provoke us, is to let that go and just don't react, because if not, that time is no longer quality time, because you start to get on each other's nerves. So quality time is just to be present and let them say whatever they want to say. You know, you've heard it 100 times, just hear it one more time, and this time don't process it in the mind. And then you have better quality time by just being present. Listen, accept, and let go. So, with that, once again, thank you so much, Dr. Tay, for your very enthusiastic sharing and also all the questions that you have taken. And I'm just going to very quickly put up the slide here. If any one of you, oops, I'm sorry, I think it didn't work properly there. Um, Yes, if any one of you is feeling distressed, we do have an assist line, which you can also contact us after office hours, because somehow more people feel down at night. So just WhatsApp us or call us, okay? And do go to our website and access our program. Next week, we are going to have Dr. Ho Yu Chin, who is a senior consultant from Tan Tock Seng, and he's going to be talking about headaches and dizziness. So headache is also one of the symptoms of stress, but it also may be due to vertigo, which is the imbalance in our ear, or maybe something else like dehydration. So whatever that may be, he's going to be a great doctor for you to consult online. And I'd like to bring to your attention our Asia Pacific Mindfulness Conference that comprise of 50 webinars, 26 workshops are available for you to register. There's going to be just full of fabulous speakers. And I hope, Dr. Tay, you've registered? Not yet?
Going to Angie, going to register.
Okay. And so you can just go to our website and get more information. So with that, thank you once again, and wishing everybody a very good weekend ahead. Bye-bye, everybody.
Thank you, Angie. Bye bye, everybody.
Thank
Have a
you.
good weekend.
You too.